Hi, it's Nick Lucas from Health Professional CPD, and one of the things we do is provide continuing professional development for osteopaths with our online program Osteoprofessional. Now, I'd like to invite you to watch a video presentation I've done for you, and it's called Diagnosis, the Heart of Interprofessional Differences. Now, we all know that there are different professional groups who all have the same patient at heart, the same person with symptoms of pain and dysfunction in their neuromusculoskeletal system. And we know that when patients experience this diversity of approach, that they actually often end up with a number of different diagnoses for their condition and also a number of different explanations for why they are experiencing these symptoms in their body. Now, very often this doesn't help patients. In fact, it often confuses them because they can't understand why there are so many different reasons or explanations for why they're experiencing these symptoms. They don't know which one's right. And often there's professional disagreement between the different diagnoses, and so this leaves the patient in a state of vulnerability, really, because they're distressed and concerned about this situation. And not only that, they're then not sure which treatment to progress with. So this dilemma has actually struck me right back when I was a student, as I experienced this dilemma myself with all the different diagnostic approaches available. And then right the way through my professional career treating patients and also teaching diagnosis at university. In fact, it led me to do a PhD in diagnostic medicine, so I guess you can see it's been something of interest to me. Now, because I've looked at it so deeply, I can definitely say that my word is not the last word on diagnosis, that's for sure, but I do believe I can offer you some valuable insights that will help you see diagnosis in a slightly different way that will be beneficial to you and to your patients. So after you've watched the video, the kinds of things you might experience, and this is what happens with people I share this with, is that you might become more efficient in private practice. And that's because when you begin to really realize what the diagnostic process is all about and why there are so many different approaches, you will learn to be able to trim down the things that you are doing in practice that aren't that beneficial, that don't really lead to any useful information. And that's something that most people I share this with then experience that in their private practice. The other major benefit of this is that when you're the one who has the big picture approach, understanding of diagnoses, and you understand why there are so many of them, and you can explain all this to the patient in a way that's not adversarial and it's not disagreeable, it just helps to explain it all and put it all in a context, then you become the practitioner who helps solve their stress around this situation. Because even though you will still have your diagnostic approach that you're going to use, the fact that you can actually explain everything else they've been through in a very simple terms, we're not talking about getting overly technical here, just in simple terms, then you become the person who helps remove the stress around this situation, and that's very beneficial for people. So I really encourage you to watch this video. I've enjoyed making it for you, and I'm sure you're going to get some insights and value out of it. And it doesn't matter whether you're a relatively new practitioner or someone who's very experienced. I'm sure you'll be able to take what I share with you and apply it to your particular level and use it to reflect upon what you do and improve what you do. So go ahead and watch the presentation. All you need to do is fill in your name and details in the form just to the side of this video, and when you click the button you'll go straight through and you'll see the video. So I really encourage you to do it, and I look forward to seeing you in the video on the other side of this web page.